my massage. So here now I've got a skin roll, which is the last part of myofascial release, is to lift the skin, create some stretch. Remember in level 3 I showed you that video of the plastic surgeon going underneath the skin, and lifting the fascia up, and we're kind of creating that space underneath the skin to allow things to move.
In our manuals it's like, they say make a C, don't they? Do you ever do that or not?
That's the last thing. So if you've got a particularly sticky area, so in around here, you might gather up the tissues, create a little C cup, a little crescent moon, and let it flatten out. So go. There you go. Myofascial release. You can do it in so many different ways. That is myofascial release. This is myofascial release, followed by this. You would never go over the spinous processes, so you'd always lighten up your touch. All of that, all diagonals, going loads of different directions. Myofascial release. Okay, so lots of friction going on. It warms the body up really nicely. It's great. Good stuff to go through. Okay, so yes, with myofascial release, make sure you check the skin movement. The direction should be multi-directions. In the direction of restriction, you should be going slow, 30 seconds to a minute glide, or even longer if you've got the nerve for it, and it feels awesome to have done. People love it and they really respond well to it. It really relaxes them down. The last thing that you would do would be your skin rolling and your crescent moons, and that would be your myofascial release technique done. If I miss any of those, or if you guys miss any of those in the assessment, it won't get crossed off. So removal of oils, checking skin, glides, and then skin roll. Okay. If you have someone, so we're going to go down to the lumbar spine. We're going to work multifidus, erector spinae, and then into the quadratus lumborum. All really good for lower back pain. For the multifidus, they move in a diagonal from the superior spinous process to the transverse process, along here. And so you want to move in a diagonal with it as well. I encourage lovely deep breathing, and I would start in and around the spinous processes in the thoracic region of the spine. 3 fingers, if you're taking a nice deep breath, Tom. As the breath goes in, the spine, the vertebra will be stretched, and as you take a breath out, they will go back to their original position. On that in-breath, go from the spinous process and work your way along to the transverse processes. So you're working erector spinae, multifidus, and you're working your way down into the grooves in between each transverse process. A little recovery stroke. Encourage your client to get the breath, the rhythm to the breath that they are comfortable with, not to try and match your pace of stroke. So get those to relax, and then just work your way into each vertebra, loosening up. Finger work. It's a really good way to start. Deeper tissue work. Multifidus. That could be classified as a soft tissue release because of the breath work, expanding the vertebra and you working across it whilst they're breathing. It's a bit of a merge of techniques because you're moving. It's not ticked by the box, by the book in terms of that, but it really helps in terms of mobilizing the thoracic spine and the lumbar spine, but the multifidus. I'm going to stay on this side. I would layer up because we've got the camera on that side. If someone has an anterior rotation of their hips, you need to be careful of a direct anterior to posterior pressure, because that will put quite a lot of pressure on the spinous processes, transverse processes, and the back and the facet joints. So your angle of compression should always be diagonal from the outside, the very lateral part of the transverse processes, into the center, in and around there. How's that feeling there?
I feel it's tight.
That's a bit tight. Once you've done a little bit of compression, just flush it through. But it feels tight in there. If I went up a little bit more, it feels like there's a bit more sort of tone and possibly a little bit more pain in this section here.
Yeah, it's a bit more tender.
So now we can go into our transverse frictioning, our trigger pointing once we've done our 10-second pressure test, and we can get in and we can do that static deep tissue work, layering up from our myofascial release into transverse frictions and trigger points. And you've got now on YouTube the videos of exactly how to do your 10-second pressure test and your trigger points and your frictions on YouTube. So I sent a link to you guys today with all of that on there. And I would do a little bit of work in and around here. Now we need to do some soft tissue release. And I think this is where it gets interesting and where I think it's really effective. Okay, for the lumbar spine, I do two things. Let's start. If your client can do it, it's great, but a lot of people just can't move their hips. And you spend ages trying to explain what you want them to do, and they just can't do it. And so I abandon it if you can't do it. But what I want to do is try and encourage Tom to stick his bum up in the air, like that, to move his hips. Anterior rotation. That is going to close the facet joints and tighten the lumbar spine, erector spinae muscles. I'm going to put my elbow in here, and I want you to try and do a posterior hip rotation. So squeeze